Today we're going to be talking about bedside care in a care facility. Have you ever actually thought about what bedside care is? You may just think it's the nurses doing cares on the residents or patients, but it is so much more than just care. Bedside care is important in a care facility because it can affect how your job is done, the quality of care given. Some residents will require more bedside care than others, and can help build relationships with the patient. In my speech, I will talk about good and bad bedside manners, why hospice residents require more bedside care, and why building relationships with the resident can be helpful. So, what is bedside care? Bedside care or bedside manner is the way medical professionals such as nurses interact and communicate with their residents. Mother and caregiver Faith Moore says, bedside care is about respect for the patient and their humanity, no matter how limited they may be due to aging, illness, or disability, permanent or temporary. Focusing on your bedside manner takes a bit more time, but reaps significant rewards. Having good bedside manner means that the nurses caring for the residents show kindness, friendliness, and understanding. Good bedside manner can also make the resident feel important, safe, and look to you as a friend or part of the family. What is bad bedside manner? This includes not showing that you care, not being compassionate about your work, poor body language, and communication or attitudes towards doing the care to the resident. This can also include ignoring the resident, rushing them, and not explaining the medication properly that you are giving to them. Bad bedside manners can lead to malpractice, which is improper or negligent treatment. Medical errors are the third leading cause of death, CNBC News reported. They claim hundreds of thousands of American lives each year. If a doctor is working in a hospital and has bad bedside care, the doctor is more than likely to be sued for malpractice by the patient or the patient's family. If a nurse in a care facility has bad bedside manner, the nurse will be reported for malpractice and may lose their job. How can you improve your bedside manner? Residents want to be treated with compassion, respect, and want to be understood. Before walking into a resident's room, introduce yourself and communicate with them by asking how their day was going or how they are doing. It is important to make the resident feel like they are important and not like they're a burden to you and the other staff. Use the appropriate language when speaking to the residents. This means using words or terms that they will understand and will not overwhelm them. Sometimes the residents just want someone to sit down and talk with. So take some time and have a conversation instead of ignoring this need. When leaving the resident's room, don't just walk out without saying anything. Say goodbye or that you will see him again in a little bit. If a resident is ringing their pendant or requesting that a nurse comes to the room, try finishing what you are doing and go down to them instead of keeping them waiting for long periods of time. Hospice residents in a care facility require the most bedside manners. Hospice care involves caring for dying patients by helping them to be free from pain, supporting them, and also being there for their family members. A hospice resident's priority is comfort and reducing any pain they may have. Being on hospice is considered a special care for those who have a limited life expectancy or an illness that affects how much longer they have to live. After being put on hospice, it is expected that they die soon, but some people may get off the care and recover a little bit. In a care facility, a hospice nurse may come in a few times a week to see the resident, have conversations with them, and give some care. However, when the hospice nurse leaves, it is up to the nurses to give the care to the resident. A hospice nurse can spend hours to up to an entire day with one resident, but their main priority is focused on them, giving them their undivided attention. In some cases, the resident doesn't have any other family that will come to visit them, which means that the nurses are the only people that the resident has. Bedside manner for a hospice resident. Sometimes the resident just wants someone to be there for them and sit down and talk. The resident may want to talk about their life and what they all did leading up to being on hospice care. If you are giving a resident medication, explain what it is and why you are giving it to them. For example, if you are giving a resident Tylenol, explain how many you are giving to them and that you are giving them the Tylenol to help them with any pain they're having. More importantly, make time for the resident. The resident may be experiencing a social death. A social death is when others, such as family members, begin to withdraw from the resident with no calls or visits. The nurses may also start spending less time with the resident on hospice since they are going to die anyways. Another death the resident could be going through is a psychological death. A psychological death occurs when the resident themselves accepts the fact that they are dying, soon, and withdraws from others so they can reflect on their life and themselves. The resident could think of you, the nurse, as their family member instead of just a nurse giving them care. This can occur when you are always with them, caring for them, and giving them the proper bedside care. This can also occur when the resident doesn't have any other family members or friends visiting or calling them. So now we're going to talk about bedside manner to non-hospice residents in a care facility. Let's say you are working as a nurse in an assisted living facility and you just got a new resident moving in. It is important to think about how the resident is feeling in this new transition. The resident could be moving out of their home into a care facility where they are just by themselves instead of living with their family. The resident could also be used to doing everything by themselves instead of asking for help. After moving into this new facility, the resident still may not used to be asking for help and will try to do everything by themselves, even though they physically can't. Not only is bedside manner important, but it is also important to help if the resident asks for it. The residents can feel insecure about asking for help since they can normally do it by themselves. It is important to show kindness, empathy, and willingness to help. The residents are the only people who will see your bedside manner. Residents will often have family members to come to the care facility to visit them. Family members will be in the room when you come in to do care, answer the patient's call, or administer pills. The family members will see how you act, talk, your body language, and how you give the care to the patient. If they feel your care was not the best, or if you had poor bedside manner, the family could report you. It is important to build relationships with these residents. This can be as little as asking an open-ended question. Having a positive attitude and smiling when first walking in can influence the resident to be in a positive mood as well. The resident may start having conversations with you outside their room if they see you in the hallways or walking outside. The resident may look forward to your company or just a conversation to make their day better. A resident could also be embarrassed about having a nurse do something for them and will only allow a specific nurse who they have built a relationship with to administer the care since they can trust them. Bedside manner is the way medical professionals interact and communicate with the residents. This means showing kindness, compassion, friendliness, and making the resident feel important. Bad bedside manner can cause medical errors, being reported, and possibly losing your job. Hospice residents require the most care, and it is important to make specific and special time for them and give them your undivided attention. Residents may also be used to doing everything by themselves before moving into the care facility. They can feel embarrassed, insecure, or uncomfortable about asking for help. It is important to make all the residents feel important, not a burden, and show them kindness. Building a relationship with the resident and having daily conversations can help improve your relationship and help you get more comfortable with your bedside care. Bedside care is important in a care facility because it can affect how your job is done. Some residents will require more bedside care than others, and it can also help build relationships with the resident. It can be hard for a nurse, especially after having a bad day, to keep up the good bedside care. Having relationships built with the residents can help the nurses as well by giving them a chance to sit and talk to someone they trust. Bedside care is important in any kind of care facility.